Here. All right, here we are. Episode 2 of Care for TV, our interview with people around Care for to learn more about what we do, why it matters. I realized actually last time when I did it, I introduced Sean, but I didn't introduce myself. And my name is Trevor Eggleton. I'm the manager of communications, marketing, and fundraising. But this is not about me. This is about you. So please start with who you are, title, where you work, things like that.
Sure. Thanks, Trevor. My name is Dianne Kuipers. I'm the manager of community support services in Eastern counties. I have the privilege of overseeing what we're going to be talking about today, which is the 5 centers that we have located in different municipalities in Stormont, Dundas, and Glengarry, which forms part of Eastern counties. I also oversee transportation and our befriending program. But today we'll be talking about our centers.
Yes. So, okay. First thing, the names of the centers and where they are.
Okay, well, so a lot of folks trip over this one because some of the names are actually after the municipality that they're located in. So for example, if I go to Winchester, you'll see the Care for Nordun Center.
And who's the lead at that one?
That would be Carolyn Rooney.
Okay.
Carolyn actually has been around. Well, Carolyn's one of on my team is the most senior employee, and she's got such a historical context to the building and all of the functions within. But yes, so that's Carolyn is our supervisor at the Nordun Center in Winchester. Then we go to Finch, and it's called the North Store Center, and Michelle Morgan is its supervisor. And she also supervises the center in Ingleside, the South Stormont Support Center. So we've got North and South, and that's Stormont area. Then we move to our Glengarry centers, and we've got one in Alexandria, which is called the Rendezvous, Care for's Rendezvous Center. And we've got one in Lancaster called the Lanchar, because that's Lancaster, Charlottenburg area. Anyway, so for those of us in Eastern counties, we get those names, right, but we appreciate that they're tough. So Lancaster is in South Glengarry, and Alexandria is in North Glengarry. And so that's why we've got those beautiful 5 centers aged between 25 to 35 years old. We're coming on one that's going to be celebrating its 35th year next year. Mm-hmm.
And the supervisors of...
Oh, sorry, yes. Yeah. So Michelle is in Ingleside and Finch. In Alexandria, we have Jackie Lalone, also a long-term, well, most of the employees have been long-term, and she's the team leader there. And we've got Tina Castonguay as our team leader in Lancaster. Great team. And their staff, awesome. Terrific collaborative group. Yes.
Awesome. Okay, so it's tricky for you, right? Because there's COVID and then there's non-COVID. And I know that COVID has obviously had a huge impact on the services that your team is able to provide. Let's picture prior to COVID. Because in each of these centers, there are similarities and there are differences in terms of activities that take place, services that are provided. Maybe talk a little bit about similarities, like sure. What is the connecting factor amongst all of them, and then what would be different in some of those different centers?
Okay, actually, more and more we're spending time on trying to standardize what we do out of each of the centers. So they're becoming more and more similar, except for one major difference. But primarily, out of our centers pre-pandemic time, they would be hubs of activity. You would have not only services such as a meals delivery happening and being coordinated out, or phone calls being made to folks who need a friendly visit over the phone happening, but you would also see a number of people coming into the center for exercise classes, or for the diners time where they'd have a nice meal on site, or for a caregiver support group, or for an educational session. It would be, I like to call them, and certainly we miss the hub of activity that we would see at the centers. We provide a basket of services, which include meals delivery, congregate activities, such as the one that I've just described, exercise, yoga, book clubs, educational sessions, dining, cooking classes, those kinds of things. Caregiver support, as I've mentioned, foot care, wellness is also offered out of our centers. We have crisis intervention and support as a service available when there are those dire situations that happen. And of course, we have our visiting and social safety program. And that sometimes involves matching a volunteer to go visit someone in their home and to establish a check-in on a regular basis to make sure that the person is safe. At our Finch site, we also have our Day Away program, which supports people who are frail and a little frailer, and others who are living with dementia.
Okay, so volunteers are a huge part
Yes.
of your programs and their success. Where would a volunteer provide support? Where would staff provide support?
It's interesting. Each of these centers, there are 5 of them, have between 3 and 6 employees on site. That's it. It's not a big staff. Really, the volunteers make it all happen. So prior to the pandemic, of course, it would be nothing to have a volunteer helping to answer the phones at the front and receiving people and welcoming them and directing them to whichever activity they were going to coming around to pick up the meals for delivery out. We have just realigned our transportation program, but we would have had volunteers coming into the center to pick up their trip sheet and figure out who they're going to pick up and who are they bringing to a special appointment. We might have had activities outside, like a walking group, and a volunteer might have been involved with that. To general administration or support to groups. So sometimes with our adult day program, we would have somebody lending a helping hand. Even just the maintenance of our building, outdoor maintenance, gardening, we would have volunteers involved that way. Really, we miss our volunteers desperately.
Yeah,
it's not the same. It's just not the same.
No, I mean for them as well, I assume. So let's go to COVID. What services are you continuing to provide? Like I know some services have increased. How has your team sort of managed through the past year and a half?
Well, the biggest thing, of course, was having to contact all of our clients and to make sure that they were well and safe. So initially, we were doing a lot of wellness checks and safety checks, and that continues to be a huge portion of our job. Now, actually, we do a lot more screening because we've reactivated some services, and we need to screen our clients to ensure that they're well to be able to participate in those. The thing that did continue and was deemed essential from the onset was our meals delivery program. We experienced a surge that we really did not anticipate. And we almost doubled what we typically do. So that's where a lot of the energy and a lot of the focus went during the pandemic. And we are now trying to transition people from our meals program to the other activities like our dining. We have a drive-through dining program starting so that the people who are more mobile and now as the restrictions are being lifted are able to participate can do that at each of our centers. We have, thanks to the restrictions being lifted, we have initiated outdoor activities. So we have some exercise classes happening, small groups, walking group, exercise classes. We have some small coffee groups that are able to engage outside. And so that's happening. But last summer during our pandemic, we reinitiated foot care rather quickly because we knew that that was a primary service that needed to continue to be delivered. It was done within all the framework and the health and safety practices that we have to have in place and continues to run. Regretfully, we don't have it happening at all of our centers, and that has everything to do with a shortage of resources. But we do aspire to have foot care delivered at all of our centers in the not hopefully too distant future.
Right.
We also initiated wellness appointments, and we changed our wellness clinics from drop-ins to by appointment, which was probably one of the best things we could have done. That's a beautiful change that occurred as a result of the pandemic. And so between 15 and 20 minutes is dedicated to a client who comes in, has blood pressure checked, maybe their sugar levels, maybe their cholesterol, blood pressure, all that good stuff. And for many of our clients who do not have a primary care physician, this is a way to monitor health. Mhm.
Yeah, that's the thing that sort of I find about the centers is that they serve needs that exist in the community,
Yes.
right? And that's one of the things that's great about them. Care for has programs and services, in people's houses and across the community, but these are bricks and mortar. How is it determined what programs and what services you're going to, provide?
Well, I think now we have a bit of a different lens than maybe was originally there 30 years ago. Ultimately, 30 years ago, there was a partnership between the municipality, the Ministry of Health, and a local organization to establish these in order to help people age well in their communities. And so the programs that were deemed to be important then are still in some cases those very same programs. But what we're seeing is we're able to now quantify in some ways the impact of social isolation. So in many ways, the programs that we offer are based on the demographic profile of the municipality. And we try to support or prevent any further detrimental health journey. So the lens that we put on now is if we see, for example, that in a certain community, there are a number of people who are living with cancer and are going back and forth to the cancer units, and their caregivers are like, they're done. Well, we know we need to put something in place, the client transportation, whatever we need to put in place for the client. But we also know that we need to support that love, the caregiver who's loving on this person and who may be at their wit's end. So there's a community health center with whom we work really closely, and they have things like the smoke cessation programs, and the dietitians are available to help with their diets. But we arrange for the groups to meet to discuss their needs and to actually provide the exercise class or provide the actual meal, or to provide that facilitator who can inform and give it some information to help with that care plan.
Interesting, because you go in and there's a yoga class taking place in the basement, there's congregate dining, people having meal together. There's sort of a certain amount of a build it and they will come kind of feeling, right? Is that you're there and just it's a place for people to be able to connect and to be active and whatnot. But it sounds like there's a certain amount of intentionality to what you're doing, right? That you are finding people in the community, you're connecting with partners to access people in the community. Like, there's no one person that uses your service, but in terms of the clients that you work with, is there, like, how do you find them? How do they find you? Like, what's that recipe look like?
For the most part, which is really interesting, they find us.
Yeah.
To this day, the highest source of referrals are self-referrals. And we partner very, very well with the former Lynn Home and Community Care. And of course, their care coordinators will refer folks to us. And we appreciate that partnership so much because it helps to support the care plan for the individual. But truly, that's how it works. And the other thing that's curious is that you don't tend to know the service until you really need it.
Yeah.
So what's neat about the centers is that you have things that are not as intimidating or health focused as a yoga class. But that's the entry point. So someone comes to a yoga class and shares with another participant that she's having a tough time because her loved one has just been diagnosed with some chronic disease. And that client will then say, you should go talk to Jackie or Tina or Carolyn or Michelle, and they will help you to find what you might need, even if it's just information. And honestly, that tends to be the way it works. We could have clients who are very, very healthy to clients who have some significant comorbidities and whose current life situation is being supported by some of the services we provide to them at home. Yeah.
Interesting. I mean, last question, and you sort of answered it, and I'm going to go take it away to a certain extent. But I mean, one of the things about Care for that makes us unique is the variety of services we provide, and that, there are opportunities for people to engage at multiple places within the organization. What would you say it is about these centers within their communities, and maybe, the whole Eastern Counties put together, that makes them unique in the communities?
Well, you mentioned a while ago, build it and they will come. I use the mantra, it takes a village. And I think that's what's so unique, is that we see community centers for younger people, kind of have a spin on that and think about what a community center for older adults might look like. And that's what I think is really interesting. The other is, of course, the compassionate staff that we have. We have some expertise that's available in a community where not primary care, but certainly a nurse's attention can be provided, whether it's for wellness or foot care, to something as minor as an exercise class, to your meals and your dining and your mental health support. It's not unusual for us to partner, as we do very strongly with our other organizations, and to have speakers come in. So to me, we're that neighbor who's looking out for that older adult neighbor, and many of whom are living alone, many of whom have children, but their children live away, and we can provide that care and a sense of relief to so many people, knowing that there's somebody in the community available and willing to help with their loved one. So I think that's what makes us unique. We're multi-service, basket of services, and the foresight that was there 30 years ago, I think, is more than ever important to recognize that there's a place for these centers, that they are health and community support service centers, and that we will hopefully be able to continue doing that for many years to come.
Yeah, I mean, you talk about, like, there's only 3 to 6 people in each of these centers, but it sounds like it's so much more.
It's community.
Than that. Yeah, without a doubt. And it's just a place for everybody to kind of come together and connect.
It's true community. If you just, if you think about your neighborhoods and you think about folks interacting with one another and supporting one another, that's how I see our centers. And it's a tribute to our staff who continue to foster that and nurture that. And we'll see volunteers and people come back through our doors shortly, and we'll be able to resume that kind of atmosphere again. Yeah,
which without a doubt. I mean, I don't want to ask, but you have a sense of, the fall, those doors are going to be opened up. There's hope for all of us across the organization. That's awesome. Well, thank you, Dianne.
Thank you,
much
Trevor.
Appreciated your time. And I mean, if anybody wants to know more, Dianne Kuipers is the person to let you know about what's going on at our support centers in Eastern Counties.
Excellent.